Hi, my name is Kelly Leech, and I did a project titled Targeting Latino Young Adults in Family Planning Education. And what I did is I did research for another class, seeing perceptions of birth control, contraception, social support, gender roles, and using contraception. And so I thought for this class I would really like to do a recommendation for lesson plans for a workshop just targeting young adult males in already established clinics such as WIC and other clinics in the area of Huntington Park, which is primarily Hispanic. Well, what really inspired me to study this project is I lived in Peru for about a year, and I used to ask my friends, my girlfriends my age, what kind of methods did they use with, and they were really shy and didn't want to talk about it, and they said they didn't really use anything, or they just used the calendar, which as we know is not as effective as other methods. I started reading, doing a little literature review and studying a little bit about what could be the barriers, and I read that the cultural machismo, using birth control might suggest infidelity, promiscuity. Latino males and specifically didn't encourage using birth control, and also there's a very high desire to have big families, and also they're very predominantly Catholic, and so in a lot of ways Catholicism restricts birth control use. And so these are the different cultural aspects I saw, and I wanted to see if this was actually true in Mexican Americans. That struck my interest at first, and then I started reading more about it. And this statistic is what really caught me off guard, is half of all pregnancies in the United States are unintended, and that's about 3.2 million pregnancies that aren't wanted. And this has drastic implications not only for the mother but for the child. It really struck my interest that this is a high burden that not a lot of people know about, and so I really wanted to do more work in the upstream factors that could cause unintended births, which is male involvement, which statistically has been shown if you involve them, then there's going to be more support around using it, which could decrease unintended births. Well, I think number one is just knowing about it. I mean, I didn't even know that unintended pregnancy was such a high burden. Being able to talk about it, I think discussion is one of the most empowering ways to change your perception and your behavior, and creating that comfortable space. And then also realizing that you could be part of that statistic if you're not thinking and planning for it. And I remember taking a class in undergrad and realizing when you could be part of that statistic, it really, really empowers you and really strikes you as, wow, this applies personally to me. And I really enjoy working in the community and seeing my hard work and my research put into action and making an impact and being sustainable. I think that's one of the most rewarding things being a student and doing work, especially in this field of public health.